Hi, my name is Phoebe Liebling and I've been a registered nutritional therapist for over a decade, and today I'm going to talk you through a hugely common and often missed digestive condition that is the cause of up to 80% of IBS cases, gets confused with chronic reflux and food sensitivities. Let's talk about small intestinal bacterial overgrowth, or SIBO for short. Started, I will flag there are 3 types of SIBO, not just one, but I'll explain this in more detail as we go through. One of the key issues is that the hallmark symptoms of SIBO can also be associated with other gastrointestinal, GI, disorders, including fungal overgrowth, irritable bowel syndrome, IBS, and food intolerances. But there are a few key differences as to how these will present with SIBO, so let's run through them. Bloating, super common. It might be after eating or relatively continuous depending on the level of overgrowth, and is due to fermentation of undigested food in the small intestine. Gas, there can be a lot. Because the issue is in the small intestine, this can often get trapped, causing pain, or pass as excessive flatulence or belching, burping. Depending on the type of SIBO, it could be odorless or have a strong sulfur smell. Diarrhea or constipation. Diarrhea is common in hydrogen-dominant SIBO, while methane-dominant SIBO will cause constipation. Abdominal pain or discomfort, such as cramping, dull aches, or pressure-like sensations due to gas buildup in the small intestine, and this often sets it apart from other GI conditions, as the pain can be quite severe and intense due to that pressure buildup, but that can then be confused as people think it's to do with their stomach, but that's just getting shoved up by the inflated small intestine. Fatigue, body aches, and brain fog are really common and due to malabsorption of essential nutrients as well as toxin release from bacterial overgrowth. Significant tiredness, muscle aches, and difficulty concentrating are often actually what get people to seek help in the end. And headaches and migraines are also quite normal. Weight changes. Some people lose weight due to nutrient malabsorption in the more diarrhea-linked forms, whereas others gain weight with the slower motility form of methane-dominant SIBO. Now, progressive food intolerances especially increase sensitivity to dairy, fruit, high-fibre foods, histamine and or sulfur-containing foods can happen and will depend on the type of SIBO, but they occur really frequently. And also inflammatory skin issues like acne, eczema, psoriasis and rosacea may worsen due to gut dysbiosis, which is the technical term for imbalances in the gut bacteria, or present for the first time in people who haven't had them before if SIBO goes untreated for a while. So, now let's cover how SIBO can be mistaken for other GI conditions and how you can start to tell the difference between them. IBS versus SIBO. Recent research suggests that 60 to 80% of IBS cases may actually be caused by SIBO. And the generalized approach that IBS is something you cope with rather than recover from is part of the reason so many SIBO cases get missed, because focus is placed on symptom management as opposed to looking for a root cause of the IBS. The slightly vicious cycle here is that IBS, where there wasn't initial bacterial changes, is a nervous system-induced condition where stress impacts the gut. And if that stress is left unchecked over time, then that makes someone more vulnerable to SIBO because they naturally get microorganism changes happening as a result of the stress. Coming back to the IBS cases that are caused by SIBO though, IBS-D, diarrhea-dominant IBS, up to 80% of cases are suggested to be linked to hydrogen-dominant SIBO, whereas IBS-C, the constipation-dominant form, a lower incidence, but between 30 to 60% are methane-dominant SIBO, and IBS-M, which is the mixed type, varies, but about 50 to 70% of people with that type will have some form of SIBO or a combination SIBO. So in summary, if you have been suffering with IBS, I would always scan back and look at your symptoms. If there is an obvious stress-induced trigger, then that needs to be addressed first. And if you think SIBO could also be involved, then keep listening for how to address this too. Now, SIBO versus fungal or yeast overgrowth, which can commonly be referred to as Candida overgrowth, but it's not always Candida that is the problem species, so we'll go with the broader terms. Both of these, fungal and yeast overgrowth, cause bloating, body pain, headaches, and brain fog, but there are some key differences to differentiate between these if you know what to look for. Fungal and yeast overgrowths present with bloating that is related to consumption of sugar-rich food and then tend to concentrate in the lower abdomen. Passing out lots of gas after eating can happen, but not always. That person will also have strong and continuous sugar cravings, and fatigue is often pretty bad. Brain fog and headaches are common, and sufferers are hugely prone to fungal infections like athlete's foot and thrush. Dandruff and skin rashes are common too. Oral and genital thrush are actually hallmarks of fungal overgrowth, and antibiotic treatment will make that worse as they kill all bacteria, allowing yeast to overgrow further. Food sensitivities are uncommon as a side effect. SIBO, comparatively, will cause a different sensation of bloating. It's more internal and feels severe, but won't necessarily cause as much visible distension of the abdomen, as it's the pressure of lots of gas being trapped inside. If that gas passes, it can be foul smelling, and that sense of fullness and internal bloating can be pretty continuous and present strongly after eating fermentable fibre from things like carbs and vegetables. Sugar cravings are uncommon though, unless somebody is very malnourished due to malabsorption. Brain fog, headaches, and fatigue are common due to high toxin levels, but any skin issues are more likely to be inflammatory due to increased histamine levels. It would be more like the eczema, psoriasis, and rosacea rather than the flaky, dandruffy stuff. Lactose intolerance, fructose intolerance, and food sensitivities are common though because of the altered function in the digestive tract. Going a bit higher up the chain now to the stomach, chronic reflux and H. pylori infection are another common mix-up with SIBO. H. pylori is a bacteria found naturally in the stomach that can overgrow when given the opportunity. And that then leads to low stomach acid, causing chronic reflux and heartburn, bloating and excessive fullness after meals, burping, and also sometimes nausea, as well as slower gut motility and intermittent bowel movements. A key difference is timing. Issue with the stomachs will present pretty immediately on eating, whereas there can be a slight delay with SIBO. It does depend on the level of fermentation in the small intestine, however, as this could be made unclear. And the other thing is things like mucus, sinusitis, and chronic coughs, which are all going to link to stomach acid issues and H. pylori, but not SIBO so much. If someone has very active SIBO, the force of upward pressure from excess gas in the small intestine can create some of those symptoms as soon as someone eats, so testing to determine would always be indicated. But often cases of chronic reflux that don't improve with stomach acid stimulation are due to SIBO, and so treating the stomach doesn't improve things. Food intolerances are the last one, and they're tricky as SIBO can lead to reactions to things like FODMAPs, dairy, and histamine-containing foods, making it easy to misdiagnose between them. Food intolerances as an immune response occur due to changes in the lining of the intestines and are more inflammatory or stress-related in origin. Comparatively, SIBO is causing issues with the function of the gut and excess fermentation, where certain foods are more triggering for symptoms, but both will cause things like inflammatory skin issues and increased allergy symptoms. If someone is becoming increasingly narrowed in their diet because of food reactions, then the first port of call is always to look at inflammation in the gut lining, as opposed to continuously eliminating foods from their routine. I would also start to look at the clustering of their symptoms and see if the SIBO picture fits. So what actually is SIBO? SIBO occurs when bacteria that typically reside in the large intestine migrate to the small intestine where they're not meant to be in high numbers. This overgrowth disrupts digestion, damages the gut lining, and interferes with nutrient absorption. And as I said, there are 3 types of SIBO categorized based on the dominant gas produced by the overgrowth bacteria. Methane-dominant SIBO is also called EMO, which stands for intestinal methanogen overgrowth. It causes constipation, bloating, slow digestion, and weight gain. Hydrogen-dominant SIBO causes diarrhea, bloating, and nutrient malabsorption, leading to fatigue and weight loss. Hydrogen sulfide-dominant SIBO is associated with foul-smelling gas, diarrhea, brain fog, and lots of food sensitivities. So now you know what it is. How do we treat it? And can you make a full recovery? Yes, but relapse rates are high if treatment is not addressed as a multifaceted approach. It's not just about eliminating the overgrowth bacteria, but also reconditioning the environment of the small intestine to prevent recurrence in future, and looking at why that person ended up with it in the first place. If they don't address that, then they would likely find it comes back. I also find it incredibly important to address the trauma around the symptoms someone has been experiencing, because they are really uncomfortable and can lead to all kinds of fear and anxiety related behaviours around eating certain foods, which is then something we want to free them from. In terms of treatment options, if someone were to visit a gastroenterologist as opposed to a functional medic like myself, they would likely be prescribed triple-threat antibiotic therapy, which sadly has an incredibly low efficacy rate and is why a lot of the stories and statistics say SIBO is a real tough nut to crack. This treatment is also often untenable for people to continue with, as it makes them feel so incredibly unwell during the process. And that's due to the fact there's no support for gut motility or toxin removal alongside. So as the overgrowth dies with the antibiotics, those toxins circulate around the body, causing flu-like symptoms, body aches, migraines, nausea, and intense fatigue. So in terms of efficacy and side effects, I'll quickly run through the main approaches for you. Antibiotics, things like rifaximin, neomycin, and metronidazole. The pros are they are fast-acting and can be effective for hydrogen and methane SIBO if someone tolerates the treatment. The cons comparatively, they'll cause nausea, bloating, and are associated with a really high recurrence rate. Methane SIBO will require all three of those due to the really high resilience of methanogens to treatment, and that has very poor treatment outcomes and high die-off symptoms because you've got all of those going into a gut which is chronically constipated, so there's nowhere for the toxins being liberated to go. Herbal antimicrobials, examples being things like berberine, oregano, allicin, which is the extract from garlic, neem, pau d'arco, and black walnut. The pros being they're comparably effective to antibiotics with fewer side effects and lower relapse rates. The cons are they take longer to work and some people experience die-off symptoms, so temporary worsening of symptoms, if not paired with appropriate motility support, but the hope would be that if you're seeing somebody who would use those, then they would also be paired with dietary and lifestyle adaptations to support that evacuation. You then also have the sole dietary and lifestyle approaches like the elemental diet, fasting, and prokinetics, which are effective but require a lot of discipline. The elemental diet starves bacteria in 2 to 3 weeks, but it's difficult to maintain, and they're only really indicated for those with chronic and treatment-resistant SIBO, or if they have structural issues such as loss of the swallowing reflex, which means the other options aren't available. You'll also often get issues with things like oral thrush and weight loss during the process with these, so they need to be carefully monitored. In terms of how I address somebody who comes to see me with SIBO, it would depend on their individual presentation, but as a general flow of the process, we start with a full assessment. As I've specialised in chronic and complex digestive health conditions for close to 13 years now, in some instances I forgo breath testing if I can clearly see that somebody has SIBO. The reason being that the use of the sugar-rich solutions, lactulose and glucose, for the breath tests increases the activity of the bacteria, which can then cause symptoms to worsen. But for conclusive diagnostic proof of SIBO, you would need to conduct both the glucose and lactulose breath tests to determine the type of SIBO. The process involves a prep diet for a couple of days, then you drink the solution and take breath samples at timed intervals. Those are then tested for methane, hydrogen, and hydrogen sulfide levels. I will always then begin with diet, both to manage someone's symptoms and to start to rework things internally. I personally don't use strict low FODMAP diets with my clients, as these add another layer of fear to foods being the cause of their issues. Instead, I favour a low fermentable fibre diet, remove dairy and fruit for the short term if needed, and get them to focus on simple meals centred around whole food ingredients. I also add in herbs and spices with antimicrobial properties, which make things taste delicious as well as adjusting their eating habits to decrease the activity of the bacteria for comfort. In some cases where an individual is really suffering due to excessive fermentation, I may consider a short-term ketogenic diet where they focus on energy from fats as opposed to carbs, as this can make them immediately more comfortable, but this requires quite a mindset shift and discipline to do, so I consider it on a case-by-case basis. At the same time, and partly with the dietary tweaks, we stabilise their gut motility. As before adding in any kind of antimicrobial interventions, we have to establish a route out for the bacteria we are aiming to get rid of. For diarrhea-dominant SIBO, those stools need to be slowed down and formed. And for constipation, that has to get moving to allow for proper toxin excretion. That could be through the use of prokinetics, soluble fibre, magnesium citrate, and/or upper GI support like digestive enzymes and betaine hydrochloride. Then come the antimicrobials to target the overgrowth. The ones we use would depend on type of SIBO, dosage to be at the lowest effective dose to prevent irritation to the gut, and this is always done with a progressive opening of someone's diet to concurrently restore normal function and prevent recurrence whilst eliminating that totally normal fear and trauma around eating and being uncomfortable. And what has been happening all the way through? Addressing root causes, of course. For me, the story of how somebody got there is the key to the puzzle. Usually there was a period of chronic stress that then led to low stomach acid and changes to the digestive system as a whole. Colonic irrigation is also often a cause, as the backward force of the water being used to wash the colon forces bacteria through the ileocecal valve into the small intestine. Chronic constipation due to poor dietary habits can do the same. Food poisoning is another trigger, and often more than one of those will have happened. Unwinding these and the habits around foods that occur as a result, often an narrowing of someone's diet, anxiety over eating in general, or at specific times and situations, is what actually frees someone from the cycle in the end. I would then embed the following practices as habits to prevent recurrence and support long-term gut health. And these are all generally things we want to be doing for good digestion, blood sugar balance, and optimal health anyway. Maintain your meal spacing. Allow at least 3 to 4 hours between meals to enable the migrating motor complex to clear bacteria from the small intestine. Grazing is the enemy of good gut health. Chew your food thoroughly. This enhances digestion and reduces fermentation. Make your meals textural by adding crunch. Be aware when you are eating and try to incorporate bitter foods at the start of the meal like nuts, seeds, and bitter leaves like rocket. Manage your stress and improve your sleep. If your body is under-rested or stressed, then our digestive system becomes less effective and more vulnerable. We also see lower levels of good gut bacteria, which will make us more susceptible to opportunistic overgrowth and issues with bowel motility. Address underlying digestive issues like poor stomach acid production, which is often decreased by stress and lack of rest, so reinforcing what I've just said. And ensure you are naturally passing daily bowel movements by being properly hydrated and having enough soluble fibre. And also try to eat a diverse diet focused around whole foods in their natural forms, as this ensures your natural microbiome will be diverse, numerous, and protective. I hope you found this video helpful. Please do leave a comment if you did, or if you have a question. And yes, SIBO is a complex condition, but it is entirely treatable. So if you are suffering, please don't do so in silence. More information on my clinical services can be found at Liebling Health.